Who owns your health records? There's an important ongoing lawsuit regarding Epic medical data fragmentation. I'm talking, of course, about Epic Systems, which is a software provider that creates B2B software for managing electronic healthcare records or electronic medical records by hospitals. Welcome to Biocomputation with Dr. Max. This is a subject matter that's central to this channel, and this lawsuit is very constructive, but its purview is limited because while this is a far-reaching problem, data fragmentation, this is a federal class action antitrust and disability lawsuit specifically brought by the American Association for Disability Justice, along with two individual plaintiffs. They allege that data fragmentation adversely affected them, and their story is very poignant. The lawsuit was filed on March 9th this year in the U.S. District Court of Western Texas. The plaintiffs specifically argued that splintering patients' medical history into separate provider-bound MyChart portals, Epic makes it very difficult for individuals, specifically disabled individuals, to put together a singular comprehensive medical record. This lack of record portability directly hinders their ability to apply for benefits like Social Security disability. Specifically, the complaints of the lawsuit include data fragmentation, and that patients are forced to use isolated provider-specific portals rather than a unified medical history interface. But also there is alleged interference where Epic actually restricts third-party technical tools and apps from easily compiling comprehensive patient files. It's not surprising that MyChart effectively splinters a person's medical history into provider-bound portals, because Epic ultimately is providing B2B services to hospitals, not patients. Logically, an institution providing medical services manages the patient's records, but no single hospital should take ownership of that data. It's not their business. So this lawsuit highlights a broader issue in healthcare, the difference between having data available and having it in a form that's actually useful. So fragmentation is not just an annoying user experience. It can become a life-changing administrative friction. And here I want to give light to John's story. John Hodges survived multiple heart attacks and triple bypass surgery. And after he could no longer work, he applied for Social Security disability benefits in March 2023. And all he needed to secure it was his medical records. But they were scattered across Epic's system, separate portals for each hospital, different logins, different authorization processes, and different waits. He tried online, he tried offline with paper forms. He walked into hospitals in person. Nothing made a difference. The system wasn't designed to let him get his own medical records. It took more than 2 years. While he waited, he became homeless. Without income or benefits, he could no longer provide for his daughter, and he lost custody. Epic says that they don't own patient data, but why won't they let the patients access it more easily? Another case in the lawsuit involved records being very challenging to retrieve after the patient died, which again shows a lack of ownership of medical records. So to summarize, Epic is highly interoperable in the aggregate, in the B2B sense, but still leaves important patient experiences broken at the B2C level. And of course, patients do not experience interoperability as some kind of arbitrary policy framework. They experience it very practically and as an obstacle. And the question is, can I get full record I need right now in one place without becoming my own medical records department? If this is a product test, it's one that the EMR system keeps failing. Patients must be able to actually assemble, move, authorize, and reuse their records without getting trapped by this institution-by-institution portal logic, because your data is online is not the same as your data works for you. So we can ask, is currently this B2B patient portal a window in your own record or a cage built around it? There are other lawsuits pertaining to ownership of medical data. Another one, also targeting Epic Systems, has to do with actually harvesting and unmasking some 300,000 patient records. A lawsuit against HCA Healthcare System talks about a topic that's very important to me and that I've touched upon in other videos before, namely revenue from medical data. And the lawsuit here claims unjust enrichment and commercial data mining, which is very much a gray area. A third lawsuit is Texas patient data disclosures, where, again, this mining of public records is able to re-identify patients. Finally, there is an ongoing lawsuit related to Metapixel, indirect tracking. Wellstar Health Systems actually settled this in July of this year, agreeing to pay $4.25 million for embedding metapixels into their portal for essentially enhancing profiting. So all of these ongoing and settled lawsuits show that this is a very important and contemporary problem of medical data ownership and organization. And we are dedicated to delivering this solution, specifically enabling individual ownership of complete medical records. This will address data fragmentation, traceability, and ownership, such as legacy, bequeathing data after a patient's death. Not only does this help with accessing the data, but it provides monetization. We're in the final stages of securing a patent with US Patent Office, after which we can not only elaborate on our solution, but launch it. Please like, share, and subscribe.